What's wrong with eating fish? A lot of people say it's healthy.
Yeah, fish has a healthy reputation, uh, in part because of observations around Okinawa, which is an island, and there was much more fish eaten than any other animal product, and there was good health and longevity. And the Mediterranean diet, again, around a big sea and a lot of fish, where there were, of course, there were animal products, but there was more seafood available because the proximity to the sea and the generally good health in people following the Mediterranean diet. But if you really stand back, so there's associations. I'm unaware of a randomized study, fish versus non-fish, on some important health outcome. It's, the language of cardiology for sure. 2 servings of fish a week to get your omega-3 in place of red meat. I mean, it may be a better choice than red meat. It's definitely a better choice than fried food, unless you're frying your fish. It's a better choice than processed fast food, a McBurger of any type. But is it actually healthy? And we know there's other ways to get our omega-3 from our seeds and our nuts and our leafy greens. There's other ways to get the protein from our beans and our nuts and our seeds and our greens and our chlorella and all kinds of plant sources. But is it actually heart friendly? And there's very little direct data. There is actually an animal study, I'm pretty sure it's a mouse study, that looked at the degree of plaque or atherosclerosis in the aorta. And they fed these mice fish-free mouse food and fish-enriched mouse food. There actually was more plaque in the aorta in the fish-enriched mouse chow. Now, we don't have a human study that's similar. And finally, fish in 2021, 2022 and beyond, they are known as what are called bioaccumulators. If you want to find mercury, go look in fish flesh. If you want to find DDT, PCBs, BPA, fish flesh and fish fat, unfortunately, accumulate these environmental toxins more than most other foods. So I have dozens, if not hundreds of patients that are fish eaters, and their blood mercury level, which is another test I do routinely, is sky high. And if I don't call them, the state board of medicine sometimes will call my patients. We got a report that your mercury level is 40. And we want to know if you're in some trouble or somebody's poisoning you or you're working at a job or you're at risk. And their answer is no, I just like tuna wraps. I literally have to, detox them from tuna wraps and get them back to a hummus wrap and use some other methods, and their mercury level goes down. So it's a real risk because mercury is bad for kidneys, blood pressure, brain, heart health. It's a serious toxin that plant-based eaters are just going to be exposed to much less.
What do you recommend for someone who has gastrointestinal problems?
Well, that's a big issue. I mean, I really, again, since it's not my main focus, will educate them that good old Hippocrates said all disease begins in the gut, and gut health is important. And gut health is partly the type of food you put in your gut. It's the quality of the food. Is it higher in pesticides and chemicals and additives and food coloring? Even our medications, shockingly, you take a over-the-counter heartburn pill or you take a prescription drug, generic or name brand, and 38 of the 40 ingredients are additives and lactose and wheat and corn, things that people are allergic to. So lots of things go in our gut, whether they're coming from food, whether they're coming actually from even prescription drugs and medications. You should read the labels and do research on your own medications if you're taking some over-the-counter or prescription. So I try and upgrade and get people to understand, let's get rid of dairy because dairy often aggravates the gut. Let's lower saturated fat, which is good by cheese and egg yolks and meats and coconut oil, because there is some data that high saturated fat diets do injure the lining of the gut and allow what people often call leaky gut or toxins to enter our body that cause widespread inflammation. And replace them with whole food plants of a variety of colors, spices of every kind except salt, that naturally all tend to support and heal the lining of the gut. A lot of variety. There's data that pomegranates, for example, and how many people can raise their hands that I had pomegranates today, but you You can buy bags of frozen pomegranate kernels. You can always get a bottle of unsweetened pomegranate juice. Or your grocery store might have pomegranates for sale, which are messy, but they're delicious. Pomegranates are unbelievably restorative to the lining of the gut and a good choice, but so are a large variety of whole food plant-based choices.
Should we eat whole food plant-based fats like raw seeds, raw nuts, raw olives, and avocados, or should we limit them? You've mentioned flax. What about flax and olive and hemp oil?
There's certainly, a variety of opinions about, is the optimal plant diet naturally low in fat, or is there room to include some of even whole foods, as you mentioned, avocados, which are very high in fiber but have a lot of monounsaturated fat and are very popular, of course, or nuts and seeds, which can be very, nutrient dense, a lot of calories, of which a lot will be from fat, but not exclusively. There's a lot of fiber and there's a lot of nutrition in nuts and seeds, of course. But everything can be done to excess and oils. And for survival and general health, we know that there are high-fat diets that are healthy. In the island of Crete, where there was, though it's not considered a blue zone, but it's part of the Mediterranean diet basin and a lot of research, it was a very high-fat diet, largely from extra virgin olive oil. And traditionally, they had very low chronic disease rates when they were studied before McDonald's and KFCs came in. And then there was Okinawa that had a naturally very low-fat diet and had pretty similar health to the people in Crete. So the human body can accommodate. Certainly, you can eat a variety of ways and get to the point of childbearing and reproduce yourself. But if you're really interested in minimal medications, staying away from the medical system and having the optimal health, there are a variety of paths, and I don't think it's resolved. Is the plant-based diet with nuts, seeds, avocados, and olives equal, inferior, or superior to the whole food plant-based diet that's very low in fat naturally, just from the foods without anything added? If it's weight loss is favored by avoiding those foods to excess. The strongest data of using plant diets to lose weight are really the ones that are, as Dr. Neil Barnard calls, low or no oil, avoiding excess fats. And when you get to heart disease patients, my field, from 1950, Dr. Lester Morrison through Mr. Pritikin, through Dr. Ornish, Dr. Esselstyn, with the exception of Joel Fuhrman's experience, which is a real experience that's published in the Science. Most of the data has been using whole food plant diets for heart patients that are naturally low in fat. So when we talk about reversing blockage, as is demonstrated in research studies, the design has always been to keep the fat content of the diet low. And until we do a different study where we maybe compare plant diets that are very low in fat to plant diets that have healthy but higher levels of fat from olives and avocados and nuts and seeds. For the severe heart patient, I teach get the low-fat version of a plant diet.